Hello and welcome to this afternoon's Glisser. Now, this afternoon's Glisser is the fifth of this week's special and extraordinary live AGM sessions that we're running for you. So my name is Rachel and I am incredibly proud to be the Chief Nurse here at Eastern North Herts Trust. And over the next hour, we're going to be showcasing to you some of the incredible stories of success and showcase some of our achievements over the last year and indeed prior to that. We're going to cover some stories around the recent months and the challenges that our workforce has faced with regards to managing the ongoing demands of the pandemic. And we're then going to hear from our lead nurses and our lead midwives about the stories that they're incredibly proud of within their own individual service and care setting. Next slide, please. So before I move on and share some stories from my colleagues, I just want to talk a little bit about this year, 2020, which for those of you that aren't aware, and I can hear many of my colleagues in the background chuckling because I make no apology for shouting from the rooftops that this year, 2020, is the year of the nurse and the midwife. Now, many people say every year, every day is that, and rightly so. We have got so many reasons to be proud. And the slide that you're looking at here is a picture of one of our own matrons, Lizzie Bessel, who in January this year was, along with myself and hundreds of other key nursing leaders and midwifery leaders, invited to the House of Lords with our Secretary of State, Matt Hancock, and a number of other really senior political leaders. And I was lucky enough to be stood in the Houses of Lords where I heard Lizzie talk about the work that she's done through a recent scholarship. And I was stood there reminding myself of how lucky I am, not only to do the job I do here, but for the profession that I have and the pride that I have in that profession. Next slide, please, David. That then links me on to another reason why at that same time I was stood there oozing with pride, where the Chief Executive of the Nursing and Midwifery Council was talking about the centenary of the NMC and the fact that one of our nurses, Karen, a critical care nurse from our unit here, who came over from the Philippines several years ago, was the lucky winner of designing the NMC centenary badge. So not only the pride in my profession, but the pride in being the chief nurse here of individuals that have shone so brightly throughout the beginning of this year of our nurse and midwife celebrations. Next slide, please. So before I hand over to Lorraine, who's going to talk a little bit more about infection control, I just think it's important that we reflect on the year we've had and the years ahead of us. And we've got really clear ambitions within our nursing and midwifery strategy. We launched this last year, and that was culminating in a year's worth of work that I and my senior colleagues had done with our nurses, midwives and AHP colleagues across the entire organisation to engage with them on what really mattered to them, what was important to them, and what did we want to see within our strategy for the future. And Karen and Jade are going to be talking to you a little bit more about some of those successes that we've reached within that, not least being awarded as one of the 14 organisations to be recognised internationally for the work that we have done around developing nursing and midwifery excellence here at Eastern North Herts. So without further ado, I'm going to hand over to the very talented and incredible Lorraine and let her introduce herself before we hear from some of our infection prevention control successes.
Hi folks, just while Lorraine sets herself up, this is David, your virtual facilitator, just reminding you all please to start to post your questions of our presenters this afternoon. You can click on the Q&A tab on the right hand side of your screen and then go down bottom right to the plus sign and just post your questions. Please do post your questions of our panel and vote for your favourites, and that way we can ensure that they get to answer the things that are important to you. Lorraine.
Hello, as I've been introduced, you know my name is Lorraine and I have the privilege of being part of the Infection Prevention and Control team here at Eastern North Herts, and we have the privilege of supporting all of you. I've been asked to put together a video just documenting some of the amazing things that have happened throughout the year, so please enjoy the video. If you don't get a mention, I just want to thank all of the divisions and all of the staff and the members of the public for doing a fantastic job over the last year. Thank you.
Hello everyone, my name's Karen Cameron and I'm very, very proud to be the Interim Deputy Chief Nurse. Today I'd just like to talk to you about our participation in the regional plans for the Year of the Nurse 2020. There was 4 main objectives for the regional plan for Year of the Nurse. The first objective was to increase the public's perception of the nurse and midwife, as well as the profession. The second was to retain nurses and midwives to stay in the profession. So that was all about retention. The third was to increase the number of nurses as new starters and new midwives into the profession. And then the fourth was to raise the strategic vision of the nurse and midwife for the profession. So in order to achieve these objectives and to increase the publicity for the Year of the Nurse and the Midwife, we wanted to celebrate each month using a different service user to highlight and showcase the wonderful work of our specialist nurses and midwives. And in order to do that, we looked at starting right at the very beginning, so from cradle to grave. So the first month was women's health, and we were delighted that Morad, the hysteroscope, was really proud to be featured in the regional newsletter. She did a typical day of her working, and we were really, really proud that this article got published in the regional newsletter, Inspire. This newsletter went out to all the academic institutes in our region. So that covered our schools and our universities to try and publicise the role of various nurses and midwives that we have. Second slide, please. The second month was February, and in February we showcased the wonderful work that Hannah Gardner, our Admiral nurse, did for her pivotal role in dementia care. And again, we were delighted that she was also featured in the regional newsletter. So again, this went out to our various academic institutes. Third slide, please. So as part of the celebrations, we wanted to do a little something different to celebrate at the end of each of the service users months. So we decided to do something a bit special at our quality huddle. So this huddle, we decided to do Play Your Cards Right. And this involved us asking questions and for the participants to say higher or lower to a various questions to answer on the facts and statistics about dementia care. It was so much fun. It was really good. And unfortunately, we had planned various showcases like that throughout the year. Third slide. So on the 12th of May, it was International Nurses Day. And we were planning a variety of various celebrations throughout the trust. However, we had to curtail them slightly due to COVID. But we absolutely ensured that our teams were given the opportunity to shine. And we did a variety of different activities that allowed this to happen. I'm now going to pass you over to Jade.
Thank you. So my name's Jade and I am the Quality Improvement Matron here at Lister, or Eastern North Herts. So I'm going to talk to you about Pathways to Excellence. So Pathways to Excellence is a collective leadership programme and a framework for nursing and midwifery excellence. Our CNO for England, Ruth May, put forward this initiative because she wanted to drive her vision of one collective voice. And this programme really embeds a team approach recognising that each and every one of us has our own experiences and has the ability to influence and affect change. And as Rachel said, we are fortunate to have this opportunity and be able to participate as the first cohort nationally, and we are one of 14 trusts who participate. We officially launched here in January, and we should be ready to submit our application in February. So why are we excited about this? Well, we know that the evidence has shown that this programme has positive effects for our patients and their outcomes and experiences, and we know that it has a positive impact for our staff. This excites us because we have this opportunity to have a huge impact on the services that we provide, from increasing our quality of care to increasing the safety of our patients whilst they're in our care, to driving development opportunities for our staff and to care for our staff wellbeing. It will roadmap an improvement journey locally and trust-wide so that we really know how we are doing and what we're doing well, what we're really proud of, but also identify the areas that we perhaps need to develop. It will develop leadership opportunities for our staff because it encourages a team engagement, and it will support staff to speak up and have the confidence to speak up and let their voices be heard. All of these are closely aligned to our nursing and midwifery and AHP strategy. And this is important to us because it will enable us to build on our strategy priorities and what we really want to represent well within Eastern North Herts. The programme is made up of 3 different components, and those are the pathway standards. So there are 6 different pathway standards, and these are all required to drive forward nursing and midwifery excellence. There is a local accreditation and there is shared decision making. And in order to qualify for nursing and midwifery excellence, trusts must be able to demonstrate that these are embedded in their practice for everyday working lives. So I'm just going to touch on our progress so far, and I will talk about 2 of the standards that we've really had a huge focus on over the last few weeks and months. And the first one of those is wellbeing for our staff. So we have seen so many different wellbeing initiatives across the trust, both locally, as in ward and department led, and trust wide. So these range from team huddles to check-ins to debriefs with staff and just leaving shift together and on time. It may well be rewarding and recognising staff that go above and beyond. And then we have our different trust-wide initiatives from our amazing Health at Work service, our employee-assisted programme. And here at Eastern North Herts, we have an amazing team of staff who call themselves the How Are You Doing team. And they have been absolutely fundamental and at the heart of the support for our workforce during this really difficult and challenging time. They have done lots and lots of different things, from greeting staff at the front door to going to see wards that have been going for a difficult and challenging time, to holding debrief sessions, to supporting training, and really, really trying to find out what matters to you. All of our wellbeing initiatives are ongoing and they're developing. And through all of this, we've really seen a real essence of cross-divisional team working and supports. It's really been transformational. So the second pathway standard that I'll talk about is shared decision making. Now, this is a relatively new concept to our trust. Shared decision making falls under one of the 6 pathway standards, as well as being a whole component to pathways itself. So each of our inpatient areas should have their own shared decision making council up and running, and we have been introducing this through our local accreditation. So we have taken a staged approach to embed this culture because we really want to work on the quality of our shared decision making and really get this right. We currently have 7 ward councils all the way through to research, and then we have a newly qualified all the way through to our newest council, which is our COVID-themed shared council. So all of our councils are at different levels. Some have completed their first initiative and they are evaluating and reviewing their QI projects, and some are working towards this. In order to support these councils, we've developed a shared decision-making network group, and we meet regularly to discuss our progress. We network together, and we can discuss any challenges we're facing and see how we can overcome this together. Alongside that, we've provided training for our shared decision-making councils, and this is led through our leadership and QI teams. The training opportunity is another opportunity for staff to network, as well as develop and grow their leadership skills. As part of our plans to restart our services, we hope to be able to deliver a shared decision-making leadership council, and we hope that this will be up and running in September. Our leadership council will be made up of all of the council chairs, and they will come together to discuss their QI projects. And from that, they will be able to join our nursing and midwifery executive committee, where they will be able to be involved in discussion and learn about key topics of interest within our trust. They will be able to voice the opinions of all of our point of care staff and have the opportunity to have their say. So now I'm going to move on to local accreditation, which is the third component to pathways. Local accreditation is a thorough and comprehensive assessment, and that's based around 6 different pillars, and each pillar will assess different standards, and within those standards we're assessing different things from patient safety to experience from wellbeing to research and leadership. All wards or departments are assessed on their achievements, and then they will be graded depending on how well they do, so they can achieve a bronze accreditation all the way through to platinum. So it recognises and highlights all the things that they're doing well and what they're really, really proud of, and this can be seen during their opportunity to shine, where we can see that the team engagement and the pride that they take in wanting to achieve and do well and perform. So they have a real desire to perform well and achieve their accreditation. So along with the certificate of accreditation, they will be given an action plan. So this action plan is a roadmap for their improvement journey, where they will be given a structure to develop and prepare for their next reassessment. So far we've had 2 cohorts completed, and of that we have 7 wards accredited, and we are very proud to be able to say that we've been able to award our first gold accreditation to NICU, who just absolutely blew us away. We are immensely proud of all of our wards and what they're doing. We are now ready to launch our 3rd cohort, where we have 5 more wards who will be completing their initial assessment. So in total, there are 6 cohorts to complete, and we aim to complete this by December. All of this work, we hope, will demonstrate our commitment to developing a positive practice environment where our nurses and midwives are able to excel and develop. All of this ready to submit in February, where we hope to be able to be awarded as a trust excellence in nursing and midwifery. Thank you. I will now hand you over to Frankie.
Hi folks, it's David again. Just while Frankie sets herself, just a reminder quickly to post your questions of our panel, please. You can hit the Q&A tab towards the right side of the screen and then go down bottom right to the plus sign, and you'll be able to post your questions. So please do post your questions and vote for your favourites for our panel. Thanks. Frankie.
Hello, my name is Frankie, consultant midwife in maternity. In 2020, the year of the nurse and midwife, we've enjoyed celebrating Alibi in different ways for International Day of the Midwife. While not the same as usual, we're adapting quickly to the new normal. It's a really exciting time for maternity nationally as we transform our maternity services alongside the long-term plan focus on maternity. Better Birth's 5-year forward view asks us to focus on maternity care that is safe and personalised. Continuity of carer is a magic key to safe and personalised care. Continuity of carer means the same midwife that knows you and your story, caring for you throughout your pregnancy and being at your birth. It's the power of relationship that transforms safety and quality outcomes and reduces inequalities through woman and midwife-centred care. Think Call the Midwife versus one born every minute, but the midwives get cars. The challenge will be changing the way we work, supporting midwives to work autonomously, staffing the women flexibly, not the building. And alongside this, we are forging ahead with delivering personalised care, offering choice to women. This brings me to talk about the learning and achievements we have realised in the current pandemic through the challenges faced. There was no step down in activity for maternity. The babies wouldn't wait. I'm so proud to tell you that we're the only trust in the east of England who have sustained our services of home birth, midwife-led birth centre continuously, thanks to the dedication to offer choice and maintain safe services. I want to particularly thank the hard work of our midwives, maternity support workers and maternity team. Our community midwives have gone over and above this and even reached out to other trusts to support women's birth choices, providing home births to women who could not access them. The current climate has meant we've had to react quickly and make changes. But when we reflect, this showcases how motivated, innovative and adaptable we can be. And between you and me, I like to think the digital transformation dream seems that a little bit closer. I think we've had success through going into the detail, adapting, changing again, and collaborating. Collaborating between teams, between specialities, departments, our service users, and then regionally and nationally has meant we're learning from others, promoting good work, and sharing resources to everyone's advantage in a way we haven't before. Some of our real wins have come through introducing service changes overnight. Diabetes virtual appointments and quick rollout of digital blood sugar monitoring have been fantastic changes to our diabetes service. The advice line we set up for women has been so well received, where women can ask questions, talk through their anxieties, and the midwife staffing that come from our shielding population have enjoyed still working with women. We've locally increased our wellbeing support for staff. Our professional midwifery advocates have set up a wobble room that's accessible to all staff. They're providing sessions in person or by Zoom at different times of day or night. And they also offer a twice weekly yoga class by Zoom. And my downward dog has definitely improved. Collaboration with our Maternity Voices partnership has been invaluable to getting message to women. These are volunteers that have worked closely with us, sometimes daily. They've joined in with the innovative approaches, co-producing digital support packs for women. And as they can't currently walk the patch to gain women's feedback, they've quickly made an online survey which can be shared with a QR code. Anecdotal effects we're noticing and learning from the unintended consequences of COVID are camaraderie and peer support between women when they're inpatient, increased breastfeeding rates, and women realising the support that staff give and communicating the impact the care they've had has given them. Women are sharing their triumphs, and they're particularly asking for this to be shared with the staff that looked after them. Women's feedback has been overall that they're anxious attending with the current situation, but overall overwhelmingly positive once they've had their babies. The feedback which the MVP support us with gaining has been the most precious gift to all of us in maternity. We are tired, but it gives you that boost to keep going. And if you ask any midwife what their best gift would be, it would be a card with kind words from someone they have cared for. While we're on headlines for maternity, I have to mention our multiple pregnancy midwife who was nominated for an RCM award, and the service uses a national example of best practice by Tamber and Nice. We've seen our mental health midwife come into post, giving one-to-one support, working with other services to make adaptable, personalised plan with women that are right for them. And we are working hard as part of the local maternity and neonatal system. We are leading on an operational group focusing on improving outcomes for Black, Asian, minority ethnic women. And our healthy lifestyle midwife has been part of developing tools which are being shared across the region by Public Health England. It has been an interesting time with challenges, but we have so much to be proud of, and it has really shone through the dedication to provide fantastic care for women and how adaptive and innovative we can be as a maternity team. I'm now going to hand you over to Caroline.
Thank you, Frankie. Hello, my name's Caroline Dilks. I'm the Head of Nursing for Children's Services and the Surgical Division here at the organisation. As the Head of Nursing for such a varied clinical area, I am privileged enough to see the care that we provide from birth right up until old age, and how this involves our patients, but also their families, carers, guardians and loved ones. Within our neonatal unit, the joy of having a baby that is then admitted into our unit due to requiring clinical care can be very frightening, and sometimes and something which our team is very aware of. I'm proud to say, as already mentioned, that our neonatal unit won the only Gold Ward accreditation so far in the organisation for Pathways to Excellence. And some of this is due to the commitment that they show working as a true multidisciplinary team between nurses, doctors, care support workers, allied health professionals, admin staff, and our families. Our families are a huge area of support for our children's services, and the Neonatal Family Support Group have worked tirelessly alongside our charities to improve aspects of care, And I'm pleased to say that on Friday, we actually put spade to soil for our neonatal Big Build project, which will extend our family accommodation in our neonatal unit. Our babies grow, and a number of them will continue to need our clinical services. And as they grow into toddlers and onto adolescents, we continue to provide a wide range of children's services, both in hospital and our local community, including care for children with complex needs, both at home and in an educational environment. This ensures that I have a very varied and exciting job, but also a very proud one, with our staff receiving a number of accolades in the last year, both within the organisation, our staff awards, and also nationally. The service was the first in the organisation to have registered nurse associates working as part of our team, and we've also just passed the first milestone for our Safe Space project, which will improve our clinical environments for our children and young people with learning needs and mental health conditions. Next slide, please. Our young adolescents then transition into our adult services, and as the head of nursing for the surgical division, my varied day-to-day leadership continues. Within the recent pandemic, I have been extremely proud to be the head of nursing for our critical care unit, and the staff that have continued to come and work within that unit from a number of many varied settings within the organisation. The commitment and clinical attitude that they have shown has gone above and beyond what is asked of them, continuing to show care and compassion to patients, families and loved ones at a time of great challenge. We've also continued our work in other areas of our services and continue to develop and implement our criteria-led discharge for our patients and ensuring that they can be discharged as effectively, efficiently and safely as appropriate. The role of the nurse has changed in so many ways over so many years, and we now take on many extended roles within both the hospital and community settings. We're proud to offer our nursing and care staff a very clear career pathway from a CSW to an advanced care practitioner, nurse consultant, educational practitioner, working alongside our colleagues in higher education, or following a career pathway into management and leadership. As I've said, I'm extremely proud to be a nurse in this very special year, and even prouder to work alongside the many amazing people and teams that I do within this organisation. Thank you. I'm going to pass you on to Deepa.
Hello everyone, my name is Deepa Austin. I'm the Deputy Head of Nursing for General and Specialty Medicine. I would like to share some of the amazing work our teams have done in the last few months. Throughout this difficult time, they have all demonstrated fine examples of teamwork, resilience, and how to support each other with compassion to deliver the right care to our patients. Just to give you some examples, 10B was our first inpatient ward to become a COVID ward. Quite understandably, it was a challenging time for our staff, but very quickly, they've all come together, worked as a team. Our doctors, nurses, and other supportive staff, they all worked together. They upskilled themselves, and they changed the way they work, changed the way they conduct ward rounds, how they update the families as we had restrictions on our visiting. So we had so many positive feedbacks from our patients and our relatives. Another ward, 9B, another medical ward, was converted into a palliative care ward to provide the right environment for our palliative patients. We had our Macmillan nurses working with the team, supporting the patients and families, and they made sure there was somebody with the patient during the last moments of their life. These are just few examples. All our wards have demonstrated fine examples of teamwork and how they embrace the trust vision to provide high quality, compassionate care to our community, even during this difficult time. Thank you.
Wow. How do I follow that? And I started off by saying how proud I am, and I genuinely do have the best job in the world. What a cast of amazing people around me. What a year. Where next? So I promise to continue to support all of our nurses and midwives to celebrate our successes throughout this year, whilst ensuring we do not forget the role we play in transforming care with compassion. I promise to do all I can to develop talent and exciting roles and opportunities for all of you. We have so much to be proud of. Thank you and all our colleagues who work with us each and every day for all you've done this year and will continue to do. Now, David, I'm hoping we have a deluge of questions for the next 15 minutes.
Thank you, Rachel. Yes, indeed, we do have lots of questions you'll all be glad to hear. But before we get into the questions, I'm delighted and proud to be able to say that the first posting and most popular posting is a comment, actually. And I'd just like to read this to all the panel on behalf of the entire nursing and midwifery workforce. And that comment is, "You have all done an incredible job in such hard circumstances. Thank you." Okay, virtual round of applause, folks. So moving on to the questions. Number one, we have someone joined the Lorraine Williams fan club. Great film, Lorraine. However, how difficult has it been to maintain standards, infection prevention control standards during the COVID crisis?
I would say that, of course, it has been a challenge. However, with clear discussion, because of the clinical groups that were set up, clear decision making, and an incredible group of individuals who are happy to do what they need to do in order to look after our patients and each other. So actually, you have made a difficult job much easier.
Great, fantastic. Next question. What's actually been the biggest thing that you've learned throughout this crisis?
Okay, so gosh, where do I begin? Let's just narrow it down to a couple of things. I think obviously at a time like this, there is a lot of personal learning that all of us go through. But I would say organisationally, I have really learned that it's about strong trust IPC culture, and it's about supporting each other, being supported by the IPC, and the IPC team being supported by external colleagues and comrades throughout this. To be honest, it's about relationships.
Great, thank you. And I think the next question actually has been common to all the virtual AGM webinars that we've run throughout the week, which is how are you preparing for a possible second surge of COVID?
Do you want me to kick off, and then perhaps some colleagues might join in? So some of you will have joined in yesterday evening's main AGM event, where Julie, our Chief Operating Officer, talked about the work that we're doing through Operation Restart. And this is our commitment to the local public, the local population, as we begin to restart the services that we'd paused during COVID, or indeed will continue and increase the way in which we are providing the volume of those services. So we didn't pause all our services. You've heard Frankie talk about the work that we've done within maternity. Not all of our services did pause, but we are preparing to restart our services. And within that, we will continue to build in resilience so that should there be a further surge, that we are ready and able to meet that demand in a further surge. And you know, we've all talked about the work that we've done around supporting our staff and their well-being, and a big part of our resilience for a surge is about our staff being ready and well enough to help us with that. And in the same way that every year we plan for winter, we're continuing to do that with our flu campaign, and we'll be working with our staff on helping them be ready for that. And you, our local public, as well, about how we support you with that. Does anyone want to add? No, I've got nods in the background. Lorraine, did you want to add something?
I did. I just wanted to say about the BAME project, because actually that's a really important way, I think, nationwide, that we're preparing for should we have a second wave. So the Trust has taken part in a project to find out which FFP3 respirator masks fit BAME staff. so that we are not in the same position that we have been. So thanks for all of you that have taken part in that also.
Great. Thanks, Lou.
Okay, thank you. So our next question relates to your presentation on pathways to excellence. The question is, it sounds like you have had a busy time ahead, or you will have a busy time ahead with pathways to excellence. How will you find the time to do it, to implement the programme?
So we know that this will be challenging for staff because it is a huge project, but we want this to become part of our everyday practice. So there will be a level of protected time that we offer to you, but there'll also be we'll also be expecting staff to be thinking outside of the box and being clever with their time, because this should become part of the normal practice and shouldn't be an additional workload.
Yeah. And I agree, just to endorse what Jade has said. This is something that will become part of what we do, and where we've learned from organisations that have already gone through the pathway programme that the success of that is about this being part of the way in which we work, recognising that we've got to have that resilience and that flexibility, and it's important that we protect time for staff to look after themselves, and that we strive for the excellence that we're doing. So completely agree, Jade, thank you.
Okay, so next question faces out actually and references our local community, and this is my favourite question. I voted for this one. What support do you need from the local community to keep you going and safe?
Brilliant. Looks like Caroline's raring to go with that one.
I was just going to say that I think the most important thing is your continued support, but your continued adherence to advice from the government and healthcare organisations. So the importance of wearing masks when you're out in public and adhering to that social distancing rule as much as possible, as well as protecting yourselves. So doing what you feel comfortable with, how you feel comfortable doing it as safely and effectively as possible, and helping us by wearing masks when you're coming into the hospital, only coming with one other person wherever possible. We know that can be challenging at times, but we'll continue to support you just as you continue to support us. So thank you.
And echoing that, so again, last night in our main AGM presentation, I know that our Chief Exec Nick and our Chair Ellen thanked the local community for everything they did throughout the recent months with their extensive donations, both in monetary but also in kind. And we want to pay some of that back, and we are running our own local community support donations on each of our sites, and as a way of saying thank you to you for all of the support and kindness that you showed to us throughout the last few months.
Great, fantastic. Okay, next question, I think, has also been a bit of a recurring theme actually through the week of webinars, and it's about organisational culture and creating good people managers. So the question is, how can we help nursing managers be good people managers?
So I'll kick off, and then again I'll defer to colleagues. So I think one of the commitments that I made and is set out within our strategy was about developing good leaders and developing talent, and I certainly made that promise to you at the end. And one of the things that we have done as we've rolled out our ward accreditation and pathway programme is take in the first cohort 20 of our ward and clinical leaders through an externally validated clinical leadership programme, and each of those 20 ward leaders and clinical leaders are reaping the benefits of that through having good improvement projects and different leadership skills. And that's complemented with all the work that our organisational development and leadership team do already within the leadership academy that's here currently. We're just commissioning the second year of that cohort, so another 20 leaders. So that will be nearly 80% of our leaders within nursing and midwifery will have gone through that really comprehensive bespoke leadership programme for them as leaders. And we're now looking at what we can do with our matrons and our next tier up in support of developing them. So a real commitment from me, from the board and our leadership team in growing that talent and development. Caroline, I think you look like you wanted to add something.
I was just going to say, I think that we support, as a senior leader within the organisation and specifically nursing, I think we support our teams by role modelling the behaviour that we expect to see, being authentic and kind to ourselves as well as then our teams, and really supporting people to develop those leadership skills, and treating others how we would expect to be treated ourselves. I think if you use that as a fundamental thought process throughout your leadership, that whichever level that you're at when you're leading, I think that won't make you go far wrong.
Absolutely. And we're just on the cusp of launching our new appraisal paperwork, and integral to that are the qualities around leadership and talent management. And as Caroline's alluded to, one of the things we do so well in this organisation is embed the values that we all hold so dear to our heart. And I think that's important, that as leaders we hold each other to account for that. So reach out to all of you to help us with that. So agree. Thank you.
Okay, I think we're all going to know the answer to the next question, but I'll ask it anyway. Is this the most memorable year of the nurse and midwife ever?
We knew it was going to be, but we weren't quite sure it was going to turn out to be this. So I think 2020 will stick with us for years to come. And I've been asked many times how it's felt to be a chief nurse throughout this pandemic, and honestly, it's a role that I'm incredibly privileged to hold, and to lead a profession that, you've heard some of those stories this afternoon, but the privilege of leading a profession through such a career-changing, extraordinary experience, coupled with absolute fear of not always knowing the answer and not knowing what's around the corner, has been a year and a few months that I will never ever forget.
And I'll just tag on a related question, if I may, Rachel, which is how will we be extending Year of the Nurse and Midwife into next year?
Well, every day, every year is Year of the Midwife and Nurse. Does anyone? How long can we extend it for? What do people think? Well, certainly when we're successful in our Pathway to Excellence application next year, that will give us yet another reason to celebrate. So I think we're all committed to celebrating the contribution we play, and I don't think that will stop. And I think this year has shown that.
Okay, I'll give you two questions in one hit now, just to give you a little bit of thinking time. First of all, how can I volunteer to support the maternity team? Is the first question. And the second question is, I understand that some nurses have been deployed in other areas to deal with COVID. Are they now going back to their usual roles?
Frankie, do you want to kick off with the volunteers?
So in terms of volunteering, when we're business as usual, we do have volunteers on the ward, and that's through the usual channels on the Trust website. It's through the volunteer programme. In other ways, if you're a service user yourself, we're really keen that service users join our stakeholder group, which is the Maternity Voices Partnership, and even just liking their Facebook page so that they can give their feedback, which then helps us to make changes in our maternity services, and anything that helps the hospital charity actually helps all of us, nurses and midwives.
Great.
And the redeployment of nurses and midwives. So yes, right at the beginning, we work with many nurses and midwives, and indeed non-nurses and midwives, as we redeployed them to support demands in services elsewhere. I talked about Operation Restart. That is our framework for looking at where we will support our staff as we restart our services. And I think it's fair to say that not one service will look the same post-COVID as it does now. And as it did before, because we have to continue to review the way in which we're providing care, and therefore things might look different post-COVID. But we will work with each individual area that is affected by that, and Karen's been working tirelessly on doing that for me over the last few months. So a huge thank you to everyone involved. But and use your Health at Work service if you need some additional support or help. Does anyone want to, Caroline, deeper add anything on that?
Okay, well, the timing's perfect. We've just coming up to the hour, and we've got one more question left. So that's great timing. Very important question, actually. Have you got enough PPE to keep patients safe in the future, or are you in danger of running out as patients return?
Great question. The answer is, in short, we would like to say and like to think yes, and we are doing everything that we can now to make sure that our store cupboard is full. So be assured that as a trust, we are exploring every avenue to make sure that we are not in a precarious position.
That's a fantastic, reassuring way to finish. Thanks, Lorraine. I'll hand over back to Rachel to conclude the session.
Thanks, David. And a huge thank you to everyone that's helped me in pulling this together today. I think, we could have spent hours talking about the things that we're proud of. So it's been difficult compressing that into the time that we've had. Big thank you to you all for joining us. And I think David will shoot me if I don't remind everyone to evaluate the session. Not that we're competitive, but I believe that yesterday's session got 10 out of 10. So if we can somehow get above that, then that would be great. But anything less than 10 just will not do. So all your feedback is really welcome, and evaluation, so that the next time we do this, we can make things even better. So a big thank you and goodbye.